What I'm going to talk about is, something, in fact, every presenter has already emphasized, and that is the role of parents and their support groups. Now, every presenter so far has already said the role of families, the role of parents is extremely important, extremely critical. And this is where, parents support groups become very critical. There are lots of gaps when it comes to the care that transgender young individuals require. The very first gap is the gap between the parents and the children. The moment a child comes out to a parent saying they are not comfortable with the gender assigned at birth, and they are actually the opposite gender, the first thing that a parent thinks of is that perhaps my child is misguided, they're in the wrong company, the social media is making them be this way, etc., etc., etc. Whereas in reality, the child has given it thought a million times and mustered up the courage to come out to the parents. And here is the parent thinking that perhaps this is happening because of the influence of social media. There are propaganda sites on the internet which tell parents that it is a social contagion, and parents can be so easily misguided into flowing down that stream. So the first big gap that we as members of parents support group can bridge is the gap between the children and their parents. When parents are able to talk to others who have gone through a certain journey and understand that this is not a social contagion, it is not a disease that can be cured, they start to really realize that their child needs different kind of help. It's not as if the child is delusional or something. Now, that's the first gap. That's the first gap that we, as members of the parent support group, can help bridge. And the most important thing we can do here is, we can stand out in the society as out and proud parents, so that parents who are getting started on this journey are able to approach us and talk to us and learn from the journey that we have gone through. The other gap that needs bridging is also the gap between these families and the medical healthcare providers. The advantage of having a lived experience that we all have is so useful for families and also the healthcare providers. The reason being that, when healthcare providers, for instance, the very first healthcare provider that a child should be taken to is a counselor, is a mental health professional. Now, there are going to be gaps here. There are going to be gaps here that need bridging, and the parent support groups can be so critical in bridging those gaps. Very often, parents themselves need counseling, and we as members of parent support group counsel parents to the extent that we can. But of course, we try to guide them and take them to proper professionals, counselors, mental health professionals who can provide the help that parents and children both need. So the role that we play, of course, in bringing up children is very, very, very critical, of course. But the role of parent support group in bridging the gaps between mental health professionals and the families, endocrinologists and the families, and the surgeons and the families, explain the need for certain procedures, explain the need for hormones, for instance. Uh, all those needs are better understood by children, their parents, when uh, there are others who have the lived experience, explaining it to them, and helping them understand the needs of the children, and also the need for medical procedures that these children need to go through. So we can play a very interesting and very useful role where as members of parent support group, we can bridge a whole lot of gaps. Also, we would like to perhaps act as watchdogs in certain scenarios. For instance, there is this abomination of this practice of doing forced surgeries on intersex children, for instance, uh, before they are able to identify their own gender identity, and that's where we can help families understand the need to wait till the child is able to understand their own identity. They're able to express themselves confidently and clearly. uh, you know the procedures need to be delayed till that happens. So uh, that's the role we as members of the parent support group uh, would like to play, and certainly I think that we need to play.